Bonjour toutes et tous. Mon colloque sera en anglais parce que c'est la langue que je parle premièrement, mais je voudrais remercier à Solène et à Cyprien pour l'invitation et pour l'opportunité de vous parler aujourd'hui sur la intersection de COVID-19, politique d'ignorance et impossibilités. Euh, je vais partager mon screen. And now I will resume in English. Just to say, I am very happy, obviously, to take questions. And for better or worse, I should be able to take questions in French as well. So if you have any questions around what the formulations mean, or anything like that, I'm very, very happy to take those. So just to repeat for anyone who may be joining and is not fluent in French, I'm very happy to be here, even if it's only virtually, with you today. And obviously, I want to thank both Solon and Cyprien and the entire collective for the invitation. I will be talking about the intersection between liberal fatalism, COVID-19, and the politics of impossibility, which is something that I have been working on personally and alongside some of my collaborators for quite a while now, starting from the time before actually the pandemic, when I was working on prediction and non-prediction. And then when the pandemic started, it just turned out that I was in some ways, I presume, well positioned to write research and other kinds of public interventions on this. I also wanted to add before I go on, first of all, can everyone hear me okay? And is the pace okay for you and for the translation? Okay, I see some thumbs up. That's a good thing. You can, I think, especially for the Zoom participants, I think there's a button that says go slower. So if you need me to do that, please do feel free to use it. I also wanted to say that listening to the contributions since this morning or mid-afternoon in English time, I'm really enjoying participating. So I will be joining you virtually for the rest of the day as well as tomorrow. Okay, without further ado, then, my contribution will focus on the implied or assumed link between knowledge and action. Why is this important? So in the context of liberal modernity, which is more or less all formally, at least, all the societies in which we live, rational planning rests on the ability to predict events, to predict risks, to predict what will happen. It is not only key to safety, it is also key to political legitimacy. What do I mean by this? In order to demonstrate or justify that they can govern and that they are well positioned to govern, governments obviously have to demonstrate that they're able to both predict and protect the public or their constituents from different kinds of risks. The underlying assumption here is obviously that if we know about or can predict threats in advance, we are well positioned to act to prevent, mitigate, or protect the public from them. So the link between knowledge and action becomes one where knowledge is meant to lead the action. Knowledge, obviously, in this case, lends itself naturally to prediction, so the possibility to anticipate future events. Prediction, then in turn, leads to prevention, possibly mitigation of risks that can be mitigated, as well as protection. Now, what happens if we start removing that link? What happens if first the ability to predict stops being connected to the ability or need or desire to protect? And then what happens if we dispense with the link between prediction and either prevention or mitigation or protection. In order to understand how this happens, I think we need to look in a bit more detail about or into the assumed link between knowledge and action, in the sense in which some kinds of actions will then retroactively shape the kind of knowledge that is presented to the public. I obviously am aware, if nothing else, even had I not been aware of this previously, I would have become aware of this whilst listening to your discussions in the previous hour, that this particular collective or room hardly needs to be told that not every action that could have been taken in order to prevent COVID-19 or mitigate its impacts or protect the public has exactly been taken, right? I think we'd probably agree on that. But I think there is something more interesting to be said about the way in which this link between knowledge and action shapes and is shaped by assumptions about political legitimacy. And obviously, not only when it comes to pandemics, we have the same kind of question shaping government's approaches, or I would say mostly non-approaches to climate change, broader environmental risks that are not limited to those that are amplified, created, or creating climate change, but also risks that governments tend to be somewhat better and more interested in predicting and mitigating, for instance, the so-called threat of terrorism. I will be referring briefly in my intervention today to what I think we can reasonably describe as the puzzle of United Kingdom's COVID-19 strategy. And by the puzzle, I mean several things. So the UK, and it's not unique in this sense, but it has been an outlier, and it has been a lot in the public focus precisely because of this irrationality or approach to the pandemic. So on the one hand, the UK is marked by what was described by different analysts, myself included, as a late, reluctant, and inconsistent introduction of non-pharmaceutical interventions. So the UK obviously is one of the countries that host AstraZeneca, was quite crucial in developing the vaccine, and that had some impact on the overall UK population in the first 2 years of the pandemic, insofar as during those first 2 years, the vaccine, including boosters, were made publicly available for free to everyone who wanted them or everyone who needed them. At this point, and starting from the end of 2022, the UK has terminated its public vaccination program, and now the COVID-19 vaccine is available to those who are defined as particularly impacted or vulnerable, and or from about 2 months ago has been available through privately provided healthcare. So you can basically go and pay for it. And it's around £100, which is about, I would say, probably at this point, between 170 and 120 euros, which obviously makes it accessible to some, but very far from accessible to all. However, non-pharmaceutical interventions, so interventions that could limit the spread, starting from obviously mandating mask wearing, but then going into more socially oriented interventions, including banning gatherings, closing schools and workplaces, or instituting the general lockdown in the UK, again, happened late, happened reluctantly, and it was not consistent in the sense in which some of these were locked down immediately, and some of these, including UK's international borders, which is basically the UK's entire border, were only closed very late and without a clear justification why. UK government's public messaging was also confused and inconsistent. So one of its famous dicta was control the virus, whereas there was no clear explanation of how the virus could be controlled, who is meant to do the controlling, and most importantly, how would we know that the virus is under control, and what is an acceptable level of control, but also an acceptable level of the absence of control, which is the key element of what we're seeing today. The UK was also very late, given its capacity, its budgets, and its overall sort of level of scientific development to develop the so-called test and trace capacity, so the ability to monitor the number of people who are becoming infected by COVID-19, certainly in the first 2 years of the pandemic. At this point, again, COVID-19 tests are available for purchase for money in pharmacies and in other kinds of health outlets, but are not available for free, certainly not to the general public. And obviously, last but not least, the UK paid a very high economic, social, and health cost of the pandemic and continues to pay it to this day. UK government's public communication demonstrated something that I think if we were not aware of what was going on, or if this weren't a focus or an interest for all of us today, would be a really shocking lack of awareness or communicated ability to predict what was going to happen. One of the chief public health professionals or officials of the UK government in 2021 said in a public hearing in the UK Parliament that they were utterly surprised by the fact that the virus had mutated. And as someone felt the need to point out on Twitter, anyone with a high school understanding of anything starting from biology to kind of just generic science would have known that viruses, yes, do tend to mutate. But most importantly, or more problematically in this particular case, the fact that the virus will mutate, that it's likely to develop certain kinds of resistance to whatever is used, et cetera, was communicated very early on by the UK government's Scientific Advisory Committee, or SAGE. Now, there are multiple explanations or interpretations circulating around why the UK was so slow and so bad at handling the virus. Most of them had to do with the realm of politics. So on the one hand, there was a claim that UK politicians were just incompetent, so they didn't know how to do this. There was, I think, a more coherent and possibly a bit more complex explanation, which is that the ideological commitment to Brexit, so the UK voted to leave the European Union in 2016. At that point, UK government's Prime Minister Boris Johnson's political commitment was also centered around what he referred to as delivering Brexit, so finalizing the departure of the UK from any kind of European Union context as much as possible, and that included trading, but also early warning signs, led to the failures of the procurement of protective equipment, because obviously the EU drove quite a lot of these. And famously, Johnson said at one point that he missed several calls from EU officials that offered the opportunity to join EU-driven PPE procurement. So there was no protective equipment, not for health professionals and not for the general public at the start of the pandemic. And then again, a bit more complexly, UK's experience of the swine flu, so H1N1, or the intervention or investment into protective equipment for a pandemic that ended up never happening, as they referred to it. So it did not. Okay. I saw someone drawing something on the screen. That's curious. So the kind of the need to invest in procuring equipment for something that turned out not to be necessary. And in that sense, there was an assumption that the reason why UK politicians were reluctant to do this had to do with the fact that they didn't want to overstretch, so to spend too much, and then it might have turned out that COVID-19 was not that much of a threat, right? Right. But then another kind of explanations focused actually on knowledge or ignorance or lack thereof. At the very beginning of the pandemic, obviously the nature of the virus was unknown, and it certainly was unknown to some degree, right? But there were also other kinds of knowledge that would have allowed us to infer sufficient stuff about how a respiratory virus that jumped species is likely to behave. However, other explanations said that in effect, it wasn't that the UK government did not have access to scientific knowledge, but it had access to scientific knowledge of the wrong kind, right? So that they were listening too much to economists or too much to epidemiologists or too much to, and there was a lot of discussion around that. So what would have been the right kind of science to guide the response? And then, not least, there was also the explanation that the UK government actually did not listen to the science at all, or even if they did, it was the people who were driven by things such as populism and post-truth, and thus had no trust in science. And some of the newspaper headlines, media headlines in that period actually reflect these opinions, including relatively sort of serious and respected media such as the Financial Times. None of these actually make a lot of sense, not because politics isn't important or because knowledge isn't important, but because the way that political actors relate to questions of knowledge, and especially public knowledge, has to do with more than just knowledge or just politics. In the framework that me and a lot of other people that I work with, including my co-author Lindsay McGooey, use, ignorance, so lack of knowledge, is not just an absence of knowledge. It is strategic. It can be used in order to justify certain kinds of political action, or in this particular case, more likely, certain kinds of political inaction. Ignorance provides an alibi for the avoidance of responsibility, but also for the avoidance of accountability. So in other words, political actors that make it clear that they could have anticipated a threat or a risk to the public, in this particular case, to public health, can justifiably and reasonably, in a democracy, and certainly in a liberal democracy, be held accountable for what they choose to do. The brilliant thing about ignorance is that if you claim that you could not have known, that it was not clear, that it was uncertain, that, as Baroness Harding had framed it, no one could have known the virus would mutate, you cannot be held accountable because there is nothing to be held accountable for. You had not acted on the basis of knowledge, and claiming that there is no knowledge or that knowledge is uncertain allows you to prevaricate or to be inconsistent in terms of the actions that you actually do choose to take, and voila. But more importantly, or equally importantly, that actually compounds your ability to govern. So when we talk about political epistemology, we really need to think about not only politics and epistemology or politics and knowledge, but their intersection. So how do they come together? In the case of UK government scientific advice, the question thus becomes not what they knew, but what they asked. And during the pandemic, and especially at its very beginning, this is just a snippet from a lot of, again, news items or headlines. There's a lot of focus on the question, so whether actually the UK government had the right kind of knowledge, whether science advisors were able to shape it, and so on and so forth. Me and in this particular case, another couple of people, primarily Lindsay McGooey, have written extensively about the way in which this argument has been used for different things. And I'm going to give you I'm aware of the fact that we started a bit after time, but I also want to make sure that we have enough time for questions. So I'm going to give you a short summary of how that worked out in the context of UK government's scientific advice, and then I'm going to give you some interpretations about what that tells us about the nature of governance in late liberalism. So why is it that political actors prefer not to know? Did I? Okay, yeah, I don't know why the slide got duplicated there. Apologies for that. I was like, I think we've seen this one before. Anyway, so scientific advice to the UK government during COVID-19 is led by the Scientific Pandemic Advisory Group, or Scientific Advisory Group on Emergencies. In this particular case, it's two subcommittees One, which is focused on mathematics and modeling, and the other, which is focused on behavioral and social interventions. Now, this somewhat interesting concept of behavioral and social interventions actually stands for interventions that are non-pharmaceutical. The Mathematical plus Epidemiological Modeling Committee was there to estimate how fast the virus would spread and to some degree what its mortality rate, so what its fatality or mortality rates for the population would be. All of this information, which is rare, is available on the UK government's website. So my analysis is mostly the stuff that I wrote was mostly based on that, but few people actually bothered to read. Now, the first question that the government asked its scientific advisory committee was not, to go back to this, was not how lethal is it going to be? It was not what can we do to protect the most vulnerable, or, I mean, they asked this as well, to be fair. But the first thing they asked was whether the public are going to riot. So the first thing that they asked was, what was the risk of public disorder? Sage told them that the risk of public disorder was low, which I think is a reasonable estimate when it comes to the UK population, and gave them some other forms of explanation in terms of what is likely to provoke public disorder, but also what is likely to mitigate it or prevent it. And one of the things that they said was that the risk of public disorder is going to be shaped by how governmental interventions are perceived by the public. So in very simple terms, if the public is perceiving that the government is not doing something or all it could to protect the population, there could be a small risk of an actual uprising. So in blunt terms, the government could fall. This is I'm not expecting you to read this, and I wouldn't expect you to want to, or I won't be translating it either. But the essence of this slide is to give you an insight into the kind of scientific advice that the group did provide. And they did consider whether it would be reasonable to try to explain to the public that if this is all before the vaccine was developed, that if some immunity is developed among the population, it would actually be okay to sacrifice some people. So the infamous herd immunity did actually occur in this particular element. And again, it was not the scientific advisors who invented it. It was the scientific advisors who were responding to the government's question about how to control perceptions, not how to control the virus. This, in my view, shows a significant, and I would say an important shift in what I described at the beginning as the assumed link between knowledge and action in the context of transformations of governance in late liberalism. So in, I would say, classical liberal terms, public knowledge is something that is governed by what some political theorists have referred to as meliorism, and I think it would be translatable as meliorism in the same kind of way. So the belief that it's possible to improve public decision-making if people are empowered or educated or equipped to make decisions. Obviously, the Enlightenment project, and that's notwithstanding its colonial, racist, etc., legacies in some ways, is in part or was in part driven by this kind of belief that educating the public is the way out of ignorance. And this kind of approach to governance then focuses on, for instance, making education public, investing in information campaigns, and among other things, obviously invests in public health, because public health in and of itself is a factor of Enlightenment-driven forms of public intervention in modern states, right? The idea is that the body of the nation needs to be healthy as well, not just the mind. In neoliberalism, this approach to governing the public shifts slightly in the sense in which governments already want to avoid responsibility for taking or not taking action. So they outsource risk to markets, whether this is financial markets or different kinds of insurance markets, or whether it's just individual members of the public, doesn't really matter for the purposes of this discussion. But they also don't really intervene in the kind of information that's available. And this is, for instance, why neoliberalism actually allows for the flourishing of conspiracy theories and all kinds of things, because in a lot of ways, the government takes the position that it is not their role to prevent anyone from communicating things, even if those things are blatantly untrue. Obviously, policy-wise, this leads to the privatization of education, something that has been a trend in the United Kingdom for quite a long time, and increasingly digital health. So the idea that health is best managed by apps, so through a phone, rather than through kind of interaction or a more constructive dialogical or collective approach to well-being. And then last but not least, what Lindsay Magui and I have done or dubbed post-liberal or liberal fatalism. The way to govern in this particular case means that actually governments do not intervene directly, but they do constrain types of action that the public can take. And in that sense, they retain ambiguity about risks. So they say, well, we're going to present you with what's there. It's your choice what you want to do. So it's your choice whether you want to wear a mask or not. It's your choice whether you want to get vaccinated or not. But we're not in any sort of way going to make it clear that, for instance, masks will, especially if worn correctly and in certain ways, will prevent infection. We will not going to make it clear that public spaces need to be ventilated and so on and so forth. So we're not going to interfere in any of that. But we are, in a manner of speaking, going to shape what you can do. And I've used this metaphor, which, you know, I'm not sure how well, and I couldn't, that's one thing I realized I don't know how to say free range chicken in French, so my apologies. But defining freedom as freedom from explicit constraint serves to ensure governmental control, basically, so it maintains peace. Because the government assumption there is that if you ban something directly, people will riot. And that maintains this illusion of liberalism, right? Liberal governments presumably should not intervene in what the public does. They shouldn't tell people what to do, as they like saying it in the UK. But of course, there is an already predefined scope of action, or you get to choose from a very limited set of choices. For instance, you cannot choose to exist in a COVID-free public space because governmental non-intervention makes it likely, if not certain, that any kind of public space is likely to contain someone who is infected with COVID. So your choice remains limited or constrained to whether you want to wear a mask or not, whether you can open windows, and so on and so forth. So the governments actually design choice architectures in this way that significantly limits what the public can do. And most importantly, from my perspective as a kind of critical scholar, what this ensures is, on the one hand, compliance, but it also ensures that there is a continuation of production, both and reproduction, both economic and social. So that means that people have to actually keep consuming, they have to keep going to work, and they have to keep going to school. So this, at the end, normalizes or serves the purpose of normalizing the exposure to harm. When your choice becomes the choice between whether you're going to sit at home and have no contacts with people, or whether you're going to go out and participate to some degree in social, economic, and just political public life, even if that entails a degree of harm, that's not a choice. That is a choice in the same way in which chickens in a free-range chicken holding pen are free in the sense in which they're free to go wherever they want, but within a limited space, and as long as they keep producing eggs. How can we combat that? And that's the last thing that I will say. Obviously, one response or one approach is focusing on self-organized collectives of epistemology or knowledge or public knowledge, just like Winslow. And that might lead to eventually the collectivization and deinstitutionalization of scientific knowledge, something that I think would be a good thing. But I also want to highlight, in some ways, this obviously raises the problem of sorting and quality control. So how do we ensure that what circulates around are not conspiracy theories or is not misinformation? And also, what is the difference or relationship between knowing the risk and being able to mitigate risk? Because as we see in the case of COVID-19, even knowing very clearly how the virus is spread and what the likelihood of infection under certain conditions is, does not really shape what we can and cannot do, because choice architectures are there to shape or constrain our action. That is it. I think I have a final slide with a lot of references, but I'm happy to share that later on. So that's it. Thank you for your attention. I think that was about half an hour. And I'm obviously very happy to take any questions. Yeah. Yes, I think we are all basically free-range chickens. We can all go, or not all of us, actually, some of us are even more constrained by governmental responsibilities. But this is increasingly the way that people are treated. So you can go wherever you want, but it's within the limited kind of space, and as long as you keep producing. Can I answer questions that I see in the chat? Because I see one which is about help and breathtaking. I think I've seen bits of breathtaking, so not sufficiently to be able to answer your question in terms of whether they accurately represent the situation at the start of the pandemic. But one thing I can say is that I've seen, I don't know, I'm assuming a lot of people would have seen it as well, in part because I think almost every TV station streamed it or played it at the start of the pandemic. I think it's called The Pandemic, the sort of semi-sci-fi, semi-horror that actually predated significantly the COVID-19 pandemic. It starred, I think, Kate Winslow and Gwyneth Paltrow. Interestingly, that turned out to be really, I thought, even uncannily in some ways anticipatory when it came to the first rounds of the pandemic, and in particular, how people can be entirely ignorant of how a virus spreads. But no, it's in some ways been too close to my area of research to actually consume, I guess, public media around that.
Hello, Jana, thanks so much. My question is, since the UK's government's first reaction was to ask, how do we look like we're doing something instead of how do we do something? And how do we keep the population from rioting? I would imagine that's basically how they deal with everything and how most of our governments deal with everything, isn't it? So I just wanted to know how usual is this framework, and if this is explicitly what they apply to every problem they have, from climate change to healthcare to education. How do we look like we're doing something?
I think that's a really good question. I think UK government is, or certainly its former government, given that the government changed in July and there is now a Labour government, which I'm not going to say anything about in the sense of it's probably, I mean, almost certainly better than the Conservative government, which was in power in the board during the preceding 5 years. But then again, As any government, it's constrained by the responsibility to govern, which I think is the main source of this kind of approach to the public that we're seeing. So with that proviso, the UK government, that has been the case with the UK government since 1997. So it was the case with the preceding Labour government, so the government that was in power between 1997 and 2007, is strongly driven by public perceptions, in the sense in which the so-called nudge technique, which is a behavioral intervention technique, was developed by not uniquely advisors to the UK government, also advisors to the US government at that point, including advisors to Barack Obama. But it was developed with the idea of, again, avoiding telling the people directly what to do. Because, and I think it's a dual approach, I think it's a dual reason. I think one part of the reason is because for liberal governments, political legitimacy rests on non-coercion, right? So the only way in which they're able to claim legitimacy is to say, we are doing what the majority wants, right? They can't say, well, no, we're just going to do this because we want to do this, which is something that authoritarian governments, at least in the ideal description, do. And I think it's really interesting to perceive that, in effect, liberal governments do try to shape and constrain the choices of their population, but that they are, as you've rightly recognized, very invested in making sure that no one perceives that as coercion, or no one perceives that as explicit constraint. So they're very, very, one of the things I didn't include in this slide is an excerpt from SAGE government's, so the advice that SAGE gave to the government, where they made comparisons with how avian flu was, or how the approaches to the avian influenza in China and in South Asian countries. And they tried basically saying along the lines of, well, you know, we know that Asian sort of countries are countries with a higher level of authoritarianism, in particular China. This is their interpretation. So there, it's actually okay to mandate, and the people will probably conform. But, you know, in the UK, you probably don't want to do that. And I think it's really interesting to perceive or to reflect on what that implies. I mean, first of all, obviously, the racist implication of, you know, everyone in Asia is obedient, which is the first problem. And then the second problem, which is people in the UK will not do as they're told. And that has not been my experience, very far from that. My experience has been that people in the UK do exactly as they're told, even when what they're told should probably contradict any kind of good sense. Including, for instance, being told that, you know, they don't need to wear a mask, or that it's safe to have gatherings in closed spaces that have no airflow. Right. So in that sense, of a lot of people who are unmasked without any testing capacity, right? So they do exactly. But I think in a lot of ways, it was primarily handling perceptions, and obviously being the ability to be perceived as still liberal was a great part of that. And I think the other part obviously has to do with the of liberalism, which is neoliberalism, which is obviously governments are trying to save money. They're cutting public spending, right? They don't want to, in fact, invest in the public. And the easy way to do that is to design choice architectures in a way that actually minimize the need to go and, you know, tell people to invest in public education, to invest in public health, right? All of these things are very expensive for governments who don't want to invest in them. And thus, it becomes much easier to do this kind of subtle shaping messages than to actually invest in a in a public education campaign.
Okay, I'll read one question from the chat. Please excuse my accent. Could you repeat a bit about the solutions? How to make knowledge available? Is it enough to have more and more awareness in the public to shift the government actions? Like the change in scale is high. How can we achieve it?
I think that's a great question. I was going to start addressing the questions in the chat. I was just noticing that they keep coming. Thank you so much, all. When it comes to solutions, I'm really cautious about how I frame this. I personally do not think, or I no longer think, that governments, certainly not post-liberal governments, have an interest in protecting the population. On the contrary, I think they have an interest to protecting the population to the degree to which that ensures that they can govern. So basically, all governments are, to kind of go back to answering the previous question as well, all governments need to maintain political legitimacy, because this is the ground for not only for their existence and remaining in power, this is also the ground on which they collect taxes and so on and so forth. So I think in a lot of ways, informing or shaping the government action through communicating knowledge, sadly not going to work, because this isn't in their interest, right? So what could work, though, and this is why I'm always in favor of kind of self-organized collectives and self-organized initiatives, is first of all making sure, so basically community protection, so community organizing to protect specific smaller communities, not outsourcing it to the government. This, as I said, has limits and risks, because there is, as a citizen or even a group of citizens, there is only so much you can do. And then obviously there are associated risks for people who are not citizens. So, sort of migrants, people who are in different ways excluded from access to public services through, by the virtue of not having the status of a citizen. But I think one thing is definitely self-organizing, so not waiting for or not trying to plead with the government to do something. And I think the other element there is a more careful political strategy, whereas the government will be consistently challenged on their absence of action. So making sure that it becomes publicly clear they're not acting in accordance with what the science is, right? That these aren't the ways to protect the public. And I think the interesting thing there, with COVID, COVID is, conditionally speaking, relatively easy example, quite clear how you can limit the spread of the virus. When it comes to more complex risks, including, for instance, the impact of climate change, it really becomes a major question of trade-offs. And no government at this point has actually taken the position or has had the courage to say explicitly, okay, this is what we're going to prioritize. So I think in a lot of ways, I would always say, personally, also from the sort of perspective of my own political philosophy, probably self-organizing is more important at this point. And we have a long history of self-organized public health communities across the world, the US, France, obviously, but also other parts of Europe, and especially non-Europe, as well as in marginalized communities in countries in the global north. But I think, on the other hand, it's really a form of making sure that there is an open conversation around what governments are not doing. Sorry if that was a very long answer.
Merci beaucoup.
Oh, de rien.